COPD is the name given to chronic obstructive pulmonary disease, and that abbreviation is used commonly now, whereas previously the disease was a combination of chronic bronchitis and emphysema. The disease affects nearly 1 million people that have been diagnosed with it, but we believe there's more than 3 million people in the country who suffer from the disease without a diagnosis having been made. COPD usually affects older people, and it affects men more often than women. The common factor in development of COPD is smoking, as the majority of patients who suffer from COPD either are or have been smokers, but there's a significant number that have not and have developed disease for genetic reasons, or perhaps through exposure to pollution, air pollution and other factors. COPD patients usually suffer from cough. This may be confined to cough during the winter months, but it often goes on for several months at a time and is productive and associated with infections where the patient may feel unwell and feverish. The other symptoms, principal symptom is breathlessness, and this develops relatively late on in the progression of the disease. And this is one reason why people do not present with COPD in the early stages. They may lose as much as 40% of their lung capacity before they begin to notice that they're becoming breathless. And if they have a rather sedentary lifestyle, they may even lose more before they actually realize they have a problem. If a patient notices these symptoms, they should go and see their GP, because the GP can do some further tests to confirm or exclude the diagnosis. The commonest test the GP would do, apart from taking the history and putting together the symptoms to point towards COPD being possible, is to measure lung function. And this is a test called spirometry. And in patients with COPD, this will be abnormal. If a GP makes a diagnosis of COPD, there are a number of things which they may do. They would certainly recommend stopping smoking if the patient is still a current smoker, as this is one of the most important things to do if one is suffering from COPD. It can slow down or stop progression of the disease if one stops smoking. The other things that are possible, although it varies with each patient, is perhaps to give inhalers, which will either dilate the airways and make the breathing easier, or reduce inflammation in the airways. And quite often GPs will choose to give the patient a reserve course of antibiotics for them to keep at home and be able to start promptly on antibiotics if they develop a chest infection without having to wait to get a prescription from a GP at a future date. And these measures, very simple, can actually make the patient feel better and also have less deterioration in the condition. COPD is still very significant, as there are a lot of people who either have been or still are smokers, and stopping smoking is the most important way of preventing any further or reducing further problems with the disease and preventing the disease from developing in the first place. The other aspects of healthy living, exercise and good balanced diet and so on are also important, but exposure to cigarette smoke is the single most important thing. We're still seeing patients coming forward with a diagnosis being made of COPD, partly because they have in the past been smokers and may even have stopped now. But there's still a significant proportion of the population who do smoke in spite of overall reductions in recent years. And people do not necessarily associate the risks that they know about with smoking to what might actually develop in them. And it is made more difficult with COPD because the damage is occurring without symptoms developing at an early stage. It is something which the first symptoms may come when already there's been quite a lot of problem develop. However, reacting to that, seeing the doctor, stopping smoking, taking the doctor's advice could well mean that things improve and the COPD does not become a major problem. If a patient has COPD and has been advised by the doctor to stop smoking, that of course will help the COPD and improve the situation substantially, but it also gives them the benefit of avoiding the other smoking-related diseases, in particular heart disease and disease of the blood vessels, which are in themselves very dangerous and very much associated with continuing to smoke. The big health pledge is a very important thing for people to improve their lives and extend their lives and make their lives healthier. For patients who suffer from COPD or who smoke but do not yet suffer from any health problems, stopping smoking is going to be the single biggest thing they can do to improve their health, the health of their lungs, the health of their heart, the health of their blood vessels. All of this is going to be a tremendous benefit from just that one pledge.